Hello patients, clients and colleagues. Welcome to AudioLogic. Today I'm going to talk to you about different hearing aid styles. The best hearing aid style for you will depend on your degree of hearing loss, the shape of your hearing loss, the size of your ear canal and outer ear, and any other personal preferences. The style that you prefer may not be the best option for your hearing loss. The audiologist will discuss all of these factors with you, and together, the correct style will be chosen for you. Custom hearing aids are hearing aids which are just inserted into your ear canal. There's no part that goes over the ear. These come in different sizes, and one of these here that I'm showing you is one of the smallest, called a CIC or a completely in the canal hearing aid. Although it is very small, it sometimes has limited features and controls because it can't fit all of the options. It also takes a smaller size battery, so you will be changing the battery more often, maybe around 3 days or so. The very small in-the-ear hearing aids may not always be the best option for the shape of your hearing loss. Sometimes these very little hearing aids work like a plug in the ear and block out some of your natural hearing. So you'll end up sounding like you're talking down a tunnel. It will sound blocked up and your own voice won't sound so natural. Often the best style of hearing aid is the one that goes over the ear and has less inside your ear. One example is the behind the ear hearing aid, or a BTE. Here you can see that most of the hearing aid and all the electronic components sit inside the device that goes over your ear. There is a slim tube and a small little dome that sits inside your ear canal. So this achieves a very open fit. It's not going to block off your ear canal, so you won't have the problem with the occlusion effect, where it sounds like you're talking down a tunnel. Over 80% of the population wear a style of hearing aid that goes over the ear because most hearing losses suit this style of hearing aid best. There is a smaller, more discreet option for an over-the-ear hearing aid called a receiver-in-the-canal or a receiver-in-the-ear hearing aid. With this hearing aid, most of the components of the hearing aid sit inside the casing which goes over the ear, but the receiver or the speaker unit is now out of the part that goes over your ear, connected via a wire, and sits at the end at the entrance of your ear canal. This allows the hearing aid over the ear to reduce in size, so it's more compact, and should your hearing deteriorate over time, we can change the wire and the speaker unit to a stronger one without having to replace the entire hearing aid. The receiver in the canal is a very popular style of hearing aid. Hearing aid technology comes in different styles of hearing aids, but they all share similar technology inside based on the same computer chip. The audiologist will discuss with you the different styles of hearing aids and what will be best for your hearing loss and your needs. Behind the ear hearing aids, or BTE hearing aids, consist of a hard plastic case worn behind the ear, connected to a separate ear mold or thin tube, and a soft silicone dome or mold that fits inside the outer ear and directs sound into the ear canal. Parts are held in the case behind the ear. Behind the ear hearing aids can be the most powerful option and often are the easiest type to adjust. Open fit hearing aids are very small behind the ear style devices connected to a thin sound tube and dome or small mold. This style allows the ear canal to be as open as possible, facilitating a more natural sound and reducing the occlusion effect or blocked up feeling. The open fit is recommended when the hearing is normal or mild in the low frequencies. A receiver in the ear or receiver in the canal hearing aid is a combination of a behind the ear and in the ear hearing aid. The main components of the system sit behind the ear and looks like a BTE. The receiver or speaker unit sits in the ear canal at the end of the sound tube, allowing the BTE component to be smaller. This offers the most discreet option for an over-the-ear hearing aid style. And should your hearing deteriorate over time, the audiologist can replace the wire and speaker unit to a more powerful option without having to replace the whole device. An in-the-ear hearing aid style, which comes in different options, such as a completely in the canal or CIC, or a ITC or in the canal, or an ITE or in the ear. These different names relate to the different sizes of in the canal hearing aids. These hearing aids are custom made to fit inside your ear canal and can assist mild to moderate hearing loss. Though these hearing aids are the smallest and least visible of the available styles, they do offer limited features and controls compared to other styles.
Thank you for joining us. Please like and subscribe to give your support to the channel, and hit the bell icon too so that you don't miss out on the next new video. AudioLogic, premium hearing care.